I'm going to knock on the door and I'm going to introduce myself. Hi, my name is Drew. I'm your nurse today. I'm just going to be coming in to put an IV in. So first I'm just going to wash my hands and I'm going to verify with the patient. So I'm just going to ask if I can get a name and a date of birth, and I'm going to check their bracelet. I'm going to check on the computer that it matches, and it does, so we're good. And I'm just going to make sure that I have all of the supplies that I need here, and I'm going to close the curtain for privacy. And then I'm just going to put my patient in a low Fowler's position. So I'm going to put them in a position, and then I'm going to ask if they have any allergies to latex or the alcohol prep pads, anything like that. If we were to be using any cream, talk about all the allergies. And then after that, I'm going to explain what I'm going to be doing. So they're in their position, we're here. So we're going to be putting an IV into you. We're going to be putting it in the arm. This is for fluids or medication. And I'm going to answer any questions, any concerns, anything like that. And then after that, I'm going to put a Chuck's pad underneath here. And then I'm going to pull my garbage can over so that I have garbage here. And then after that, wash my hands again. And I verified that they need an IV, so we're going to go ahead and do that. So I'm going to get everything set up. So I'm going to open this. And then I'm going to alcohol prep this, both sides. And I'm just going to take the saline. I'm going to make sure it's not there. And then I'm just going to be flushing this to make sure that make sure that it works and that there's no bubbles. Okay, perfect. So we got that ready. Now I'm just going to take my needle out. Sorry. Get that prepped. I'm going to take my needle out and open it onto here. And I'm going to put this on, the tourniquet onto their arm. Want that to stick. Okay, and then I'm going to now put my gloves on. Before I would put my gloves on, I'm going to look for a vein. So I'm going to look for a vein. I'm going to palpate for one. This looks like a good vein right here. So I'm just feeling for that. And then now I'm going to put my gloves on. Okay, so now I'm going to take an alcohol wipe and I'm going to clean this. And now I'm not going to touch where that was at, and I'm going to let that air dry for 30 seconds. So that's air drying. I'm going to make sure I have everything ready, and I'm going to open my needle. Okay, now that's dried for 30 seconds. I'm going to go in with the needle and wait for a flashback. I see it. So now I'm going to push the catheter in, pull the needle out, and put that into my safety. I'm going to keep holding this while holding that up there, and I'm going to put this extension here. So I'm going to keep holding that. And now I'm going to pull back a little bit to pull back. Yep, there's blood. Now I'm going to flush it like that, and I'm going to lock it. while still holding that so that it doesn't move. And like this. There we go. Okay. And while I'm doing this, I'm just going to be reassuring the patient that they're doing great, answering any questions while I'm doing that, making sure that they're feeling okay. And I just did that backwards. So I'm going to put that on the right way while still reassuring the patient. And I'm just now going to take this tape off. That's set. Now I'm going to take this off. And I'm going to tape up here, take the tourniquet off. When I put this in, I would have taken the tourniquet off immediately before I taped all of that flushing. I would have taken the tourniquet off. I didn't do that, but that is what I would have done. I'm going to put this piece of tape here, push that down. And then I'm going to grab another piece of tape and I'm going to tape that right there so it's not in the way. Okay, perfect. I'm just going to clean up around them and take my gloves off and put some hand sanitizer on. So now that we have this IV in, again, I'm going to answer any of the patient's questions, see how they're feeling. I'm going to teach them to look around this to see if it's ever red, irritated, or if it's ever hurting, to let me know so that we can come in and check on it. I'd be back in 30 minutes to look at it and be checking on them. And now that it's in, I would go and document where that IV was put in and where at and how it looks. And I would clean up all of my surroundings, make sure I would put them back in the comfortable position and get them anything they needed. And yeah, and I'll be back in a little bit.